So, talk to me. What's going on?
So basically, I've had like knee issues. I'm a pro dunker, so I like travel around the country doing dunk contests and shows and stuff like that.
That's awesome.
So it's a lot of jumping, and I've been dealing with this probably for like 3 years. It was since I was in high school. And I used to have Osgood slaughters when I was younger. And yeah, it just hurt like on that bump right there. And it like gradually started getting better. But I don't feel like it never like went 100%. I had it in both knees. This knee is like, it went 100%. Like I don't feel anything on that.
Okay, cool.
But yeah, basically like every time if I'm doing like high bar squats, I do a lot of like lifting too. And when I do like high bar squats and things like that after the workout, it'll be really tender. Sometimes like the tendon swells up. And yeah, it's just been bothering me for like a long time. And I've never really got it like fully taken care of. It got better around a year ago. I treat it like it's tendinitis, but I don't know if that's like the exact issue. And it got better around a year ago, but then there was like one day I was playing, I did a 1 foot jump, and then that's when it like started bothering me again. And yeah, it's just like it gets better and then it like gets worse, and it's kind of just a wave like
up and down, up and down. Okay, cool. Yeah, sounds like it's probably a tendinitis. Well, you know, we'll test it out and see. There's a few other things it could be.
I think I'm a go. That's the name of Arizona. I've been in Georgia. Sun is shining in Florida. I'm a free bird smoking on California. In Indiana. Got a mood trying to boom out in Jupiter. Stand still, now you're closer to Lucifer. Got a Colt 45 trying to loosen up. Got a buzz online trying to boost it up. Got a dad and a mom trying to make him proud. Got a bag and a bong trying to bake a pound. I'ma up my ante, touch my Grammy, go my family down to Miami. No, they can't control my visa. My world, I roam like Caesar. My song, my girl, my diva. Good drink, my good sativa. God knows I'm far from lousy. Lord knows I'm smoking loudly. Hot box, I'm riding cloudy. Eyes drop like Ronda Rousey. I think I'm a go. That's the name of Arizona. I've been in Georgia. Sun is shining in Florida. I'm a free bird smoking on California.
Good. Hips back and keep the knee from coming too far forward. There you go. Good. Hips back. Keep the knee too far. There you go. Feels all right?
Yeah.
Cool. Break.
Yeah, I felt it all on my hamstrings.
Nice. Good. We want hamstring glute here. So the great thing about knee injuries is that if this is giving you issue, you can typically load up extra into glute and ham. You know, which, you know, deadlifts improve your vertical too. So we just get
so I can still weight train and stuff like that.
Yeah. It's just about figuring out which movements you can do and which ones are going to be kind of restricted for right now. It's never a you have to stop. It's always you have to modify. All right, which is what we're all about. So, all right, another set. Good. All hand, there you go. Perfect. Sweet. Good. All good?
Yep.
Sweet. All right. Let's get some real weight. One more. Good. Walk it in.
Let's see. Another thing. I'm glad that the shoulders have come along so well. Like, that's actually really cool that you're able to get that.
Cool. Again.
But not like that. Like that one.
Let's try 6.
Freaked out a little, but I left it alone. Feeling good enough. Push it up.
Butt back.
But this one, it's almost as if you feel it.
One more.
Only when I'm here.
Good.
Okay.
I start feeling.
Okay, because that's what
How was that?
That's what happens. So
Pretty good. It's like small as full, but it's nothing like
It wasn't
It's
that.
still below like a 2 out of 10.
Okay, cool. So we'll just work. We would just work here.
Okay.
All right. So we'll just knock out. We'll knock out like 4 sets of 6
All right.
here. All right. So whenever you feel recover, give yourself a minute at least, and then you can go again.
All right. So
The great thing about like right now, like this is so low level for you that you'll be able to train it a little more frequently if you wanted to. Tendons need about a day in between. They typically need 48, 72 hours to kind of hit their stress and recovery cycle. So we'll give you like 3 days a week. Train it Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday. Just give yourself a day in between how often you're gonna train it with the squatting, and then we'll do the isos in between just for the neurological.
And then as far as weight, should I like keep it the same? Or?
Yeah, so we'll go over all that. Basically what we're gonna do is we're gonna have you work up to your best pain-free set of 3.
Okay.
And then we'll do like a percentage back off of that. And I'll get you out like a program for that.
All right, sounds good.
Cool. That's it.
Really feel stretching, and then this side, the shoulder leg, I was always awkward, but I went slow yesterday, really slow.
Perfect. Good. One more.
Very conscious of
So as you get stronger, as it gets more comfortable, when we get the weight up around 135, 150-ish, we'll start letting you let your knees drift a little bit more forward, getting back more into that natural squat pattern.
Yeah.
Right now we're in kind of, I call it unload, reload. Like I'm trying to unload your knee by letting you put more stress into the hip, and then we'll reload it back up, build it back in as it gets desensitized. Yeah. So as it becomes less sensitive, your movement repertoire starts to increase again, and we start to work things back in. So we will get you back. We will get you back. So how far down do the safeties go on y'all's racks? Are they the ones that are like they stop here, or do they go all the way? Or do you have?
There's some, it's like a bar you adjust.
Okay.
And then
Cool.
It can go
It can go pretty low?
Yeah.
Cool. So what we'll do, so your accessory movement is going to be lunge.
Okay.
Good. Because we were able to do that fairly pain-free. So what we're going to do is we're going to get here like this, and then we go back. You see now it's going to block us from getting into our painful position.
Okay.
Okay. So now this can't drift forward.
Yeah.
All right.
How close to the?
Pretty close.
All right.
So maybe something for you if you're ever uncertain about what you're doing, like literally put your hands on it and see like
There you go.
that and they're like this.
Very nice. So if you how it kind of wants to go forward, but it's blocking you and keeping you back where we want you, that's what we're after. We want you to kind of groove in that pattern of that step back without that knee travel, just for right now. Again, as we progress, we let your knee come forward again.
Okay.
But this is what we would use for more of our like volume. After we load, we put we'll keep that more low volume, and then this, because we're already doing it pain free, we'll load more volume into it. So once you kind of have the groove of this, then you don't necessarily have to have the bar there. This is just
That's just
it's just feedback for right now. Cool. Other side.
Girl,